guys. Okay, tonight's B discussion: understanding and minimizing sundowning in dementia patients. Okay, so we're going to delve into that one for you, and for everybody's information, that falls under brain health and geriatric care for me. Okay, so with that being said, let's get going. Sundowning is a distressing and often misunderstood phenomenon in dementia care, marked by a noticeable increase in confusion, aggression, and behavioral disturbances during the late afternoon and evening hours. While not every person with dementia experiences sundowning, for those who do, it can be one of the most challenging aspects of caregiving. Fortunately, with thoughtful planning and compassionate strategies, its impact can be significantly reduced. Okay. What is sundowning? Sundowning refers to a cluster of symptoms: restlessness, irritability, disorientation, pacing, hallucinations, and verbal outbursts that tend to intensify as daylight fades. It's most commonly seen in individuals with Alzheimer's disease and other forms of dementia, and it often coincides with changes in the body's internal clock, circadian rhythm, sensory processing, and environmental cues. Common triggers: fatigue from the day's activities, low lighting and increased shadows, which can distort perception, sensory overload, or understimulation, unmet physical needs like hunger, thirst, pain, or toiletry, medication side effects, or timing issues, disruption in sleep wake cycles, unfamiliar surroundings, or changes in routine. Why it happens. The brain's ability to regulate time, perception, and emotional responses deteriorates with dementia as daylight winds. The brain struggles to interpret visual cues, leading to misperceptions and fear, combined with exhaustion and possible discomfort. This can result in behavioral Acceleration. Some researchers also suggest that hormonal changes in the evening may play a role. Prevention and management principles. Stabilize daily rhythms. Consistent routines for walking, meals, activities, and bedtime help anchor the day. Avoid scheduled disruptions like late appointments or unexpected visitors. Minimize daytime, light, and activity. Natural sunlight exposure helps regulate melatonin and sleep cycles. Engaging activities like music, puzzles, or light exercise promote alertness and reduce restlessness later. Minimizing evening triggers reduces noise and clutter. in the evening in the evening environment, avoid overstimulation from TV, visitors, or complex tasks. Dim lights gradually to signal winding down, but avoid sharp shadows. Address physical needs. Pain, constipation, hunger, or urinary issues can trigger aggression. Regular hydration and toiletry routines reduce discomfort. Use familiar and calming cues. Photos, music, scents, and objects from the person's past can soothe and orientate them. Gentle touch like hand massage or brushing hair may offer comfort. Environmental adjustments. Lighting. Use warm even lighting in late afternoon and evening. Avoid flickering bulbs or harsh contrasts that can confuse. Install night lights in hallways and bathrooms to reduce fear during nighttime movement. Space design. Simplify surroundings to reduce visual clutter. Create safe walking paths for pacing or wandering. Close blinds or curtains early to block triggering shadows or headlights. Routine and activity planning, morning and afternoon. Schedule physical activity like short walks or chair exercises. Encourage social interaction and cognitive stimulation. Keep naps short and early to avoid disrupting nighttime sleep. Evening, offer a light, satisfying snack to prevent hunger related aggression. Avoid caffeine and sugar after midday. Use soothing rituals like listening to music, reading familiar stories, or looking through photo albums. Okay, now guys, here are some sample routines. I'm going to read this for you now. 4 to 6 p.m. Calm activity, light snack, bright room, or short outdoor time. 6 to 7:30. Quiet shared meal, dim lights, slightly avoid loud TV. 7:30 to 8:30. Soothing activity, music, photos, preparing bedroom, toiletring. Bedtime with consistent cues. 8:30 to 9:30. Pajamas, blanket, favorite object, soft music or white noise. Communication techniques. Speak in calm, reassuring tone. Use short, simple sentences. Validate emotions rather than correcting facts. Redirect gently to familiar or comforting activities. Offer limited choices to reduce overwhelm, e.g., would you like tea or juice? When seeking medical help, sudden changes in behavior or escalation of symptoms, signs of infection, pain, dehydration, or medication side effects, safety concerns like wandering, aggression, or falls. Consult with a primary care provider, geriatrician, or neurologist for assessment and medication review. Caregiver support. Share evening duties with family or hired help if possible. Create personal rituals to decompress after stressful episodes, e.g., deep breathing, journaling, a warm bath. Join a support group or connect with a dementia care specialist for guidance and emotional support. Quick checklist to reduce sundowning tonight. Ensure exposure to daylight tomorrow. Use warm evening light in the evening. Offer a Offer a light early evening meal. Limit caffeine after midday. Plan a calming bedtime ritual. Check for toiletry and physical comfort. Remove hazards and ensure safe wandering space. If you'd like, I can help you build a personalized daily care plan for a printable evening checklist tailored to your loved one's needs. Preferences and triggers. Just let me know their typical routine mobility level and what tends to soothe or upset them. Okay. So that is B for you. I'll try and do a C in a little bit. I'm gonna go take a break for now. So I will be back on with C if possible. Um, Till then, Gator Wellness, take care, folks.